Hello, everyone. I'm Jen Rumbalski, the director of the La Crosse County Health Department, and I felt like today we just needed some hope and happiness. So I've got my chipper on, I've got my bright colored shirt on, and I'm just ready to try to give you whatever positive I at all possibly can. So that's my mission for today. To start out with our case counts, I feel like I have a new favorite number, and that is 9. Because it's less than 10 and it's not in the 20s. So that is what our current number of cases is so far for today, the number of positive results that we've received in today. That brings our total number of positive lab confirmed case number to 620. We have 14,208 negative results in total. We currently have 5 individuals who are requiring hospitalization. We have recovered 451 out of the 620, which means about 73% of our total cases have recovered. So that's good news too. And we continue to have no deaths in La Crosse County residents. So happy to report that. In Wisconsin, we have seen higher numbers of positive cases over the last week. Several record-setting days for positive case numbers. Today is not a record-setting day. So we are at 821 positive cases in the state since yesterday, which brings our total of positive cases to 38,727. We have negative test results for the last day of 13,104. We have a total ever hospitalized in Wisconsin of 3,923. That number is up 31 from yesterday. Our total recovered individuals in the state is almost 30,000, and it is 77% of the total of positive cases. And so that compared to ours at 73%, we are getting closer to what the state has been for percentage of those that have recovered. Number of deaths has increased by 1, with a total now in Wisconsinites of 827. So one other good piece of news, I think, hopefully you also think it's good news, is that we are now taking all of our own cases. We are not sending any of our cases to the state, and that has been over the last 2 days. So I'm really proud of our team for getting those cases back. I think it's really important that our team be able to do that. It helps us be faster. It helps us have better connections with our community. And there are a lot of positives to that. Also knowing that there are a lot more cases at the state level, the state's ability to take on cases from counties across the state is becoming more challenged. And we're just really glad to have the ability for us to take our cases on again and not be sending those to the state. The National Guard testing site that we had last Friday, so far we've had 20 positives come back from that National Guard testing site, of which 15 were in La Crosse County residents. I'm not surprised by that, just because I think the amount of virus in the community is higher than it had been a month ago. And we had a lot of folks that came to that site who had symptoms and needed testing. And we did go through all of our test kits, all 400. So I expected to see a number of positive test results come out of that site. At the end of this day is when we said, if you're still waiting on a test result, if you haven't received word that you were negative or positive, then you can go ahead and contact us and let us know you're still waiting on that test result. But we are prioritizing any of the positives that we've gotten to make sure that we are notifying individuals if they are positive. So sometimes if we make a call or the National Guard calls on a negative result and they leave a voicemail or don't get a message or the ability to do that, then you may not have gotten your result. So just let us know if that is the case. The next item is to just talk a little bit about the business recognition initiative that we launched a week ago, and that is called Check the Spread. You can look at that website at www.checkthespread.org. And that website, if you look there on safe businesses, if you click on safe businesses, it shows you a list of all the businesses in our community that have pledged to follow those 6 guidelines, of which one is making sure that all employees are wearing a face covering or a face mask at all times when they're in the business. And I'm really, really proud to say that we have 106 or 107 businesses that have pledged so far. So within 1 week, I think that's really positive news. We continue to get new businesses that are pledging. And we have had, I think, some positive buzz about being able to recognize businesses in our community that are really doing the right thing. So I think that's going very well. We do have a phase 2 of this initiative, and we're beginning to work on phase 2 now, again, in conjunction with all of our partners that you can see listed there on the website. And phase 2 is really in large part about inviting and really encouraging larger companies, those that might be corporate in nature, where there is a sort of a longer process that might be in place in order to get a pledge like that to occur or be approved. We're working on contacting some of those locations. We think that will be really important. We also continue to be in communication with all of the partners that are engaging in that initiative. And it's just been very positive. So thank you to all of the partners and all of the businesses that have pledged and all of the businesses who are working towards pledging. So we're really grateful. I think it's really a wonderful thing for that to be happening in our community. The compass is updated, and that happens every Wednesday as a reminder. So a couple of things. First of all, when you look at the compass today, you will note that we have not changed in our overall status. We remain in orange high risk. Our epidemiology metrics are looking pretty good, though I do have a note about that. Healthcare looks pretty good. The public health metrics, which are a lot about being able to get cases, getting results quickly, getting to cases and contacts quickly, continues to be a struggle. So we do remain in orange high risk. What I want to say is that as we always are reviewing everything that we do from a quality improvement standpoint, we have found 2 specific opportunities where we will be adjusting the metrics within the next week. So next week, when we update the compass, this will be talked about more then. But want to just give you a heads up so that you know that this is coming. It may or may not impact our compass update next week in terms of status. But the first one is metric 3. And right now, metric 3 is in the epidemiology section and is about 10% decrease in new cases. So it's about basically the amount of increase or decrease that is occurring in cases. The state has now launched data in this area, and they are incorporating, and these are data terms, but burden, which is the total number of cases per 100,000 over the last 2 weeks, along with trajectory, which is really the percent change in the last 2 weeks. And we don't currently have that burden piece in our metric. Which is really the rate overall of cases. So both of those should be in that metric. And we think that is not only a best practice, it also would align us with the state's metric and is the right move to make with that particular metric. So we do intend to adjust that metric to be covering both of those rather than just the percentage of change. Secondly, with metric number 7, metric number 7 currently falls in the public health realm, but what that metric is really telling us is how quickly do we get the results of a test that's being conducted that is positive into our electronic disease surveillance system so that we can action that and do something with that positive test. And really, public health doesn't have the ability to adjust that or try to decrease that time frame in any way. It is all happening prior to public health. And so we believe that that metric belongs in the healthcare realm. So we will be shifting that metric to go under healthcare. And we will also be looking at adjusting it to be, it currently says all cases are referred in 24 hours. What we really, in order to really decrease risk, we want to see that the time frame from when someone is swabbed or is their test is conducted to the time that we get that result in our electronic disease surveillance system, that's really the time frame where we want to be monitoring and keeping that short so that we can action that as quickly as possible. I will just say that already some of our healthcare partners are helping us by when they notify someone of their positive test result, they're going through a HIPAA compliant JOT form that we created at the department that helps get at some of that information, like where have you been in the community, who are your close contacts, so that we may even have that before the disease investigator even calls the individual. It doesn't replace the interview, but it does give us a head start on making sure we can decrease risk in the community. So we are always looking to improve that system, the timeframes in which it takes for someone who might be symptomatic to the time when we are able to appropriately notify someone about what their isolation or quarantine instructions are, and get their close contacts and connect with those close contacts. So those are a couple of adjustments that you'll see and you'll hear more about next week that we'll be making to the COMPASS process. And we believe that those are evidence-based and will improve the metrics. So just a heads up on that. Then next I want to just share, again, I think times right now in our community and in our nation are really challenged, and there's a lot out there that isn't positive. And today my mission is to be positive and to bring hope wherever possible. So a couple of things in that realm. I think when we look at our community and areas where there are opportunities, where support is available, or where really we are working to support each other, we should raise those up whenever possible. So first of all, there is a back to school supplies campaign going on right now. The Coulee Region Back to School link will be posted on the Facebook page, but you can look that up for a back to school supplies donation drive. In addition, the 4-H is doing a blood drive on Friday, July 17th at the health department building. So at 300 South 2nd Street. And that is from 9 to 2. And again, that is on Friday at the health department, the Health and Human Services building. And then finally, we are going to launch a quick little fun campaign called Mask Up Lacrosse, where we would ask that you send us a message in our Facebook message box and just send a selfie of yourself in a mask, or you could do it with your household contacts. And we want you to tell us who are you masking up for? So because when we wear face coverings, it's really about protecting those around us in case we might be in that pre-symptomatic stage of COVID and not know that we might be spreading. We're really protecting others. So it would be fun for us to know, who are you masking up for? So feel free to send us that in our Facebook inbox, and our team will put more information out about that. We will have a little incentive drawing for those that submit a selfie picture of them in their masks. So thank you in advance for doing that. I think that'll be a really fun activity. And lastly, I am going to prioritize my family next week, and I will be off next week. I will not be in the department responding. I will be with them. And so Carol Drury will be the incident commander next week, and will be doing the media briefings, and we will have some guests next week. We'll bring back Sarah Johnson relating to mental health and wellness messaging for us on Monday. And we also hope to have some information about COMPASS and data specifically on Wednesday's briefing. So with that, I think those are my updates, and I'll take questions from our media partners and our folks on social media as well.
Hey, Jen, this is Justin at WKBT. Just to start off, this week we heard a plan from Trump, and I guess what is your reaction to, possibility of hospitals kind of bypassing the CDC with updates on COVID-19?
Well, I did hear about this, Justin, and I am concerned about that. I don't like to see politics get in the way of the way that data-driven analysis, data collection, and response can happen. So I think that anything that bypasses essentially the National Health Department, which is the CDC, is very concerning to me. I really believe that part of what has caused this whole COVID response to be challenged and significantly different than any other response to any other communicable disease outbreak is the fact that all of that data and the guidance that really gets created out of data to be data driven is not political, yet there have been political pieces that have interfered with the typical process that allows us to provide that really evidence-based information to our public. If we are not doing that together in a way that is really smooth, then it makes it really difficult for us to provide that information. It means that potentially the data is not being collected and analyzed in a way that we can access it and we can create guidance materials at a federal and state level. It then means that we are utilizing resources in a way that may not be as efficient and then takes our time and energy potentially away from where our response should really be, which is in preventing cases in the first place and in trying to get at cases and contacts as quickly as possible so that we prevent spread.
Jen, so asking for your reactions, what would your reaction be to Walmart now saying that they're requiring masks?
Sorry, Marcus, I missed. Not Walmart saying what?
Walmart saying that requiring people to wear masks.
Yeah. Well, I think that any business that is willing to require the use of something that I, again, think is a very simple and effective tool to prevent spread is really important. I recognize that masks have become political in nature, but masks are not political. This is about a virus, and it is about how a virus spreads. And the virus spreads from person to person via droplets. And when we wear a mask, if we are potentially infectious, those droplets can get caught in that mask material. Are they 100% effective? No, this is not an N95 respirator. This is a face covering, but they can help prevent the spread of the virus. And again, anything that we can do right now to prevent the spread of this particular virus, which seems to spread very easily from person to person, is a really important tool for us to be utilizing. And unfortunately, there are many people that choose not to wear masks. And I think that businesses do have the ability to make that requirement. And I think that when businesses do that, it does help protect their employees and their customers when they're in that business. And I think those are important moves that our businesses are looking at. And I'm pleased when I see a business making that requirement. Again, this is not political. It's not about what you believe. It's about what the data says. And the literature that I've reviewed and looked at indicates that it is a tool that can help decrease the spread of disease, especially when it's layered on top of other what we call non-pharmaceutical interventions, which means not having a vaccine. It means what you can do up until you have a vaccine to get immunity. You look at the tools of washing hands, physical distancing, wearing a face covering, all to help decrease that chance that droplets that might be infectious with virus can get to the next person and be inhaled and infect the next person.
Justin with WKBT, and I apologize if this is kind of, I think you might end up saying kind of the same thing, but if the CDC is bypassed, is that a concern for the public health information for the public, as well as the quality of that information? And I guess, what are some of the timelines that would be kind of come out of that from that information getting out there?
Yeah, so Justin, I just want to make it clear that at the national level, that is very concerning. The CDC is an important entity that collects information. What specifically I'm aware of is the National Health and Safety Network, which is a place where hospitals from across the nation were reporting information and data to. Locally, our impact may not be as big as at the national level. We do have local healthcare systems who do share information with us. We work very closely together. We have data sources like our Compass, where we pull information into those metrics from local sources, including in our region, the counties that surround La Crosse County. We have access to data that is just Wisconsin level. So I think the impact to us locally, I am less concerned about than the impact nationally. Though I do want to just make sure that it's clear that national impact can come down and impact states and locals as well. It's more about being able to have access to the level of data from across the nation to utilize that in ways that help us learn about this virus. Since it is still very new, it helps us identify where the challenges are in our healthcare systems with lack of access to personal protective equipment or lack of access to the amount of resources in the hospital or healthcare systems that we need, like ICU beds. So that level of data at the national level is important, but may not be specifically impactful to our local area yet. And again, I think what we have locally in our partnerships is very strong, and I'm really grateful to our local partners, and it helps inform our recommendations. I'll just reiterate that since the beginning of COVID, in my time in public health, and I've been through a number of outbreaks and situations relating to communicable disease, of course, not a pandemic, but it is concerning to me when we basically bypass what would be considered our national health department, that can cripple certain aspects of the response from a big picture level.
So is it only politics that would be a reason to bypassing them, as you say? Like, what other reason could there be for that? Why would that ever need to be?
I wish I had an answer for that, Marcus. I have no idea. Why would we want to do that? I think I also really am surprised by our decision to pull out of the World Health Organization. I think that there are beliefs in that. And I do think politics plays a really big role in that. I'm not judging. I'm simply saying that those have been effective systems for us to be able to get evidence-based guidelines to drive local decision-making and share information. And without that, when you don't have structure, then the chances that you have chaos goes up. And we've had to work exceptionally hard here in La Crosse County to build our own guidelines out of the data. We're putting in a lot of time and energy to make sure that we have data-driven guidelines for everyone to follow. And a part of that is because typically we see those guidelines and that data-driven process happening at the national level and then coming down through states to locals. And that frees our resources up to really support what's needed at the local level, as opposed to 72 counties in Wisconsin building their own guidelines. It really is about working together across local, state, and national systems and worldwide. So when you pull out some of those pieces to the system, it's it can be very difficult to make sure that we have enough bandwidth to support all of the needs associated with our own residents and the response that we want to provide to our own residents.
Justin again. I want to switch it up back to the National Guard testing sites. The next time this happens, will they have more tests? I believe they ran out after about 400 or so. I guess kind of going off that, I guess, are they going to have more? Or?
Yeah, that's a good question, Justin. I don't know what the most recent max number of tests is. Typically, we do request the max number of tests. So there is a top number, and I will verify if that is 400 or if it is higher. But I would estimate that we're going to be requesting the max number of testing kits that we can in a given time frame in which we're doing it. So do recognize that this next testing event in Onalaska at the Omni Center is not as many hours as other testing events have been, but I will verify that question for you. Thanks, Justin.
Go ahead, Wisdom.
Oh, sorry. Unmute. Okay. The hospitalizations, I know there was 5 today. There was 4 for the past couple of days. And maybe this is a metric I'm missing, but with hospitalizations, all 4 could have recovered yesterday or into today. And then 5 new people could have went to the hospital in the last 24 hours. Is there a metric I'm missing there? Do you know the total number of hospitalizations we've had in the county, since we've been reporting this stuff? And is there a way to to see that 3 new hospitalizations, kind of how the state reports it? They put new hospitalizations and then a total number.
Yeah, that's a good question. I don't have that in front of me right now, but I can tell you that, our hospitalizations in total have been fairly low. And we have had several of those that have been hospitalized for quite some time. So I can tell you that it's not like all 4 yesterday were discharged and we have 5 new today. We've had a couple of fluctuations, but the majority are those that have been hospitalized for quite some time. Though I don't believe anyone, to my knowledge, is in ICU or requiring high critical acuity, but they are in need of hospitalization. Yep, good question. So we'll look into that for you.
What are your recommendations for when schools are in the midst of their planning? What should they do? How should they handle school bus safety?
Yeah, so we're having, schools, I think I again will just say I'm really proud of our school districts. It's a big lift for them to make sure that they can keep their staff and students safe. I know that there is concern amongst those in the community about schools being opened in the fall. I can tell you that we are having very detailed conversations about everything from, monitoring of staff and students, the mask issue, how to keep them safe while they're waiting for the bus or walking to school, how to make sure there's enough space to physical distance. So many of them are considering utilizing cafeteria and gymnasium spaces. How to, even in the elementary, thinking about when young people are getting ready to go outside and all of that, getting on your winter gear, simple things like putting on your mask and scarf at the first step, and maybe calling out every third space in the hallway to make sure you don't have kids really close together. It's a big lift because there are a lot of new pieces that schools are trying to implement to keep staff and students safe. And, I have recently likened it to, we hear from folks that are really, maybe concerned about students wearing masks. And I think about it in the way of, the active shooter trainings that schools have been doing, active shooter trainings. And as a parent myself, that can be really difficult to explain to students. And just because it's difficult and it's new doesn't mean it's the wrong thing to do. So when it comes to masks, if that can help decrease the spread of the virus and keep staff and students safe, then it needs to be one of the considerations in the planning. So I would just ask, again, I would say I'm really proud of our school districts all working together for some time now, continuing to move into the really detailed aspects of planning. And I know there are a lot of questions and a lot of thoughts and feelings and beliefs about schools opening in the fall. But I think, this really is about constructive communication and trying to support schools that are really doing their very best to protect staff and students. So if you can lean in, if you have a concern or a question, I think you just have to bring that up in a constructive way so that it can be considered as part of the planning. And just recognizing none of these decisions are easy. These are things that schools have been talking about for some time. Again, they've had huge lifts in the closure of the schools in the spring and how to adjust that so they could meet the needs of the students and the faculty when they had to change on a moment's notice. And then how to do summer school. And then when practices could start again for potentially fall sports. This has to focus on the learning environment. And I just want to remind all of us, including myself, who really like being part of extracurricular activities, going to sporting events, that these schools are going to follow the COMPASS guidelines, and they're going to work with the health department in making sure that students and staff are safe. And that means having trigger points for when school might need to be closed, or if we're in red, then we should not be having sporting events. If we're in orange, we shouldn't be having sporting events. The questions are, can we do practice safely? So all of these levels of details are going into conversations with schools, and it's a big lift, and those are really hard, big decisions to make, and schools are doing a really good job with that. So if you have feedback, I think you need to share that in a constructive way, but please remember that everyone is working really hard towards the same goal, which is to balance the need for our young people to have a learning environment, to continue growing in that learning environment, and to be safe as possible. So I want to share that it is not just as simple as, yep, we're going to open schools and we're just doing some planning. It's very detailed. It's very difficult work. And there's a lot that goes into it, and constructive feedback and support and suggestions are always welcome.
Justin again, kind of staying on the National Guard, as we were talking about earlier. When a National Guard testing sites end, will local healthcare providers change the criteria for being tested?
Yeah, everything, I feel like there are a lot of really tough things happening right now. This is another one. Our testing capacity with the level of virus in our community, until that level of virus means that we don't have as many symptomatic individuals who need to be tested, which I frankly don't see happening anytime soon unless we're really changing some practices and we're really more consistently wearing face masks when we're out and about. Virus will continue to be out there. People will continue to get symptoms and need testing. And right now, we're not even able to test individuals who don't have symptoms but are a close contact. And again, a lot of this is about making sure we can keep our healthcare providers safe so that we are not having them care for someone who might be positive for COVID and spreading it in a hospital setting. So that takes top priority. And then making sure that we can support the testing for those that are symptomatic, and including those in our long-term care assisted living facilities where spread would happen more readily. And that's really where you're most likely to get severe illness and death. So it is prioritized now. I don't foresee that we can open those up widely until we have less virus in our community. I am still hoping that the state can expand the National Guard resource. They were on federal orders. I don't know what that process looks like, but we certainly are communicating and hoping that the state can keep National Guard on orders to support. But if that is not the case, which right now we have nothing to indicate that they will be extended, then we are going to have additional challenge to just support those that need testing right now. So with everything that I've said today, I think the most important thing is that we need to have everyone picking up a piece of this challenge. This is a huge boulder to lift up, and not just a few people can do it alone. If we don't have everyone doing their part, and I mean everyone doing their part, doesn't matter what your political beliefs are, if you believe in a mask or not, we have to be doing these practices, or we're going to continue to see lots of virus in our community and all of the potential negative effects associated with that.
Okay, back to schools. We're playing ping pong here. Two things. First, is it ridiculous that, I don't know if you think this is, but is it ridiculous that, say, Canada has like 600 cases in a day and the United States has 60,000 cases in a day? And I know if you get locally, it's a little different, but you're saying the virus is pretty prevalent here. Is it a little ridiculous that we're talking about opening up schools? And also, when you're meeting with these schools every week, or school leaders, is there one, like, the biggest change that we would have with in-person schools? Say maybe the teacher is behind a divider, or maybe there's a divider down the middle of a hallway, like at, you know, how you walk at Walmart, you have to go one way. I don't know. Is there a big change there?
You know, I think that, is it ridiculous to think about opening schools? I don't think it's ridiculous to think about opening schools. I think every part of this is really about balance. And we saw a lot of students in the spring who did not engage in that learning environment that was more virtual. These are young brains that we need to continue to help learn. This is our future. And if we already know the recession that can happen with the learning of our students over the summer, which is the reason for summer schools. You know, we really can't afford to see that level of knowledge be lost. That will really be challenging. So if there is any way that we can have schools be in session and protect staff and students, and I'm going to be kind of raw and say, you know, that might mean we don't have sporting events. It might mean we don't have forensics. We can't have swing choir. It might mean we really focus on the core learning processes that are the most important aspects of the school environment. And that might mean that we, you know, that schools need to really say, you need to be in a mask. And maybe there are times during the day where that isn't necessary. But again, this all comes back to the tools that we currently have and maximizing every single one of those tools in conjunction with each other to decrease the risk levels for the spread of this virus in our schools in order to have some kind of a learning environment to support our future generation. So again, these are tough decisions. There's a lot of pieces that go into them. You know, I myself had to answer a survey about my own kids. My husband is a teacher. I'm on a school board. This is tough stuff. And I want my kids to be safe in school. And I'm going to feel safe if my school says that that masks are going to be required for students, because I know that the literature says that they can help prevent the spread of this virus. Every single one of those tools that the schools can be using, if we can do that successfully, the environment can be as safe as possible. And I think it is important to try to give our kids the chance to have a learning environment so that we can continue to support them as really our future.
Minnesota is starting to allow essential caregivers the opportunity to go back into nursing homes to help family members. Is this recommended here in La Crosse County? And I guess, you know, why or why not?
Yeah, I heard about this in terms of like personal care assistants, positions like that. You know, again, as with any staff member, if that's considered a staff member or not, you know, currently in La Crosse County, visitors are not allowed. This is another really tough one, a big debate about, you know, quality of life versus life itself for our residents in long-term care and assisted living facilities. I've spoken with many folks about this topic. I struggle. If my grandma was still in a nursing home, I would really struggle to not be able to go see her, have contact with her. But when it comes to, essential care workers, if what we're doing here is in a safe fashion, and again, there are pretty specific guidelines for these facilities that if someone is entering and they are going through an active monitoring process, that cannot be present in the building if they have any symptoms of COVID, if that is a strong process. And then if they are in full personal protective equipment, meaning a surgical mask and goggles, and it depends upon the resident, but potentially also gown and gloves. If someone is considered a person under investigation at a nursing home, which means that they might have a symptom and are in the process of being tested, those individuals should not get visitors. But these are risk-based decisions, and really there's a task force that's working on trying to decrease all the risks possible with this potential or this specific population in long-term care and assisted living facilities. So if the risks can be minimized the best possible, they're in personal protective equipment, they're going through active monitoring, then maybe that would be possible. I don't know where that level of discussion is for essential care workers, specifically in our facilities in La Crosse County. But I can tell you that we remain with not having the ability to have visitors in the physical space of individuals. And there are some that get to go to a doctor's appointment with a family member, for example, if they're in assisted living. Assisted living has less restrictions and more movement capability. But again, all of those situations can add risk. And then that risk doesn't just impact that one individual who's in assisted living or long-term care. It can impact everyone in that facility. So I think that just has to be handled carefully and making sure that we're decreasing risk wherever possible.
So just to kind of continue off that and kind of just clarify one thing. So have you had conversation with area nursing homes about this approach, or kind of, Minnesota's hop, skip, and a jump away from us, I guess, kind of just looking at the differences, or maybe even kind of copying them in a sense?
Yeah, I'm not sure specifically for our facilities in La Crosse County if essential workers, if that means personal care workers, if they're being allowed into facilities. I know that they look very carefully at all risk, and we're not allowing visitors in general, or visitors in general are not typically allowed in long-term care. That varies in assisted living. So I don't know the specific answer to that, Justin. And I can check with that strike team that meets weekly to find out what conversations, if any, they've had about that specific topic.
Why do you think it took a large grocery store business like Walmart so long to require masks?
That's a good question. I don't know. The only business that we know of in La Crosse County that is requiring masks, at least to my knowledge, that's a big box store, is Menards. I think that this should be happening already. We should see this popping up all over. Again, when we have a tool, a kind of another raw answer for you, when we have a tool like masks that can decrease the spread of this virus, I get the concerns about that it may be political, that it may not be comfortable. But when we have healthcare and literature and evidence that indicates that this is a tool that can decrease the spread, and we don't have a vaccine, and we know that this virus spreads very easily from person to person, I just don't understand why we aren't maximizing everything we can do to utilize every tool we have. And I think that there is power and authority at the level of businesses that they can make those decisions for their employees and for their customers to do that requirement. And I would encourage more to be looking at that option. I really believe it shouldn't have to take a mandate across the board to get that kind of work done. And you know, I just wish that we could have more compliance with that simple, easy tool. Unfortunately, for a number of reasons, again, one of them being politics, that there's beliefs out there that it is just not the right thing to do. I just don't see that in the data. I don't see it in the literature that indicates that there is a reason on that side, other than personal belief and maybe political viewpoints. And I'm not being political in any way, shape, or form. I come at this from the data and the literature and the evidence that I see. And I also come at it from an ethics perspective. And when we look at, you know, the protection of the public, and we have individuals and businesses that are not maximizing that tool, seems like an easy win.
Any other questions for Jen today from our media? No other questions, Jen.
Okay, well, that was a whole lot of tough situations to talk through. I think that does really tell you that a lot of what's happening with COVID, you know, can be really tough stuff. And so, you know, be kind to each other. This is not easy. It's very difficult for us to have to physical distance from those we love. It's difficult for us to say, you know, to ask for behavior changes to occur. It's difficult to make behavior changes. It's difficult to come together when there are beliefs that differ. But again, we can only beat this virus if we do come together. That's a choice that each of us gets to make, is coming together and working together and being united against a virus and not against each other. So I remind all of us that this is going to be a marathon, not a sprint. We have things that we can do to improve our current situation with the level of virus out there. You know what to do. We have guidelines out there. They haven't changed. Make those choices now. Work together. Try to listen to each other, and just remember to be kind, because as human beings, we're all in this fight together against a virus and not against each other. So thank you so much. I will miss you all next week, and I will see you the week after. And next week you'll have Carol and Sarah coming on Monday. So take care of yourselves and your loved ones, and I look forward to when we're back together again.